So I'm absolutely thrilled to welcome Dr. Elizabeth Bates to share her latest research and insights on this very important and indeed timely issue, with the launch of the Violence Against Women and Girls strategy not that long ago, which of course does include men in the VORG strategy. So Elizabeth, I'll pass the baton to you, and we'll hear from you for about 30 minutes, 40 minutes, something like that. And then it'll be open to questions from all of you. Thank you. Elizabeth.
Thank you. Thank you so much for the generous introduction. I'm just going to share my screen. So then you can see my slides. So I'm notoriously bad at managing my time. So if it looks like I'm going to go on for too long, please just tell me. That's absolutely fine. So thank you very much for having me here. It's really a pleasure to be part of this webinar series, and thank you for inviting me to share my research. So yeah, my name's Liz. I'm from the University of Cumbria. I've been there for about 15 years now, and all of the research that I've been doing, the majority of the research that I've been doing since I got my PhD in 2012 has been focusing on working with male victim survivors of domestic abuse, looking at their experiences and looking at the impact of these experiences on them and their children. So I'm just going to kind of cover a few different areas. I've tried to do almost a bit of a summary of the research as we know it at the moment, and kind of consider what we know about their experiences, consider something called identity abuse, look at a bit around men's help seeking, and then at the very end I am including a little bit of data about a new study that I've done working with practitioners to try and understand the barriers they experience in working in this area as well. So, as Nick quite rightly identified, there are quite a lot. There are quite a lot of men that experience this. What I meant to say is that there are a lot of people that don't recognise or realise, I should say, the number, like the prevalence of men who experience domestic violence, and certainly the proportion of victim survivors of domestic violence who are men. So according to the Office for National Statistics 2025, in the year ending March 2025, and the data for this current year, which obviously has passed now, won't be published probably until around October, November time. So for the year ending March 2025, 3.8 million people over 16 in England and Wales experienced domestic abuse. And this was made up of 2.2 million women and 1.5 million men. And this means, importantly, that the proportion of overall victims that are male is just under 40%. And I think that this is still a figure that shocks people. I think that there is an increased awareness of the fact that men experience abuse. But I think that when we talk about the number of it, and when we used to talk about the 1 in 3 statistic, and obviously it's gone up now, I still think that there's quite a lot of people that are surprised by the prevalence of it and the proportion, as I say, of victims that are male. So what do men experience? Well, some of the early research in this area that had looked at quantitatively looked at the prevalence around domestic abuse and had basically asked men and women historically in their relationships, what happens in what happens in terms of when there's conflict. And we used something called the conflict tactics scale. It is an ACT-based measure that basically allowed people to say, when there's conflict, this happened or this happened, rather than, are you a victim of domestic abuse or is this something you've experienced? Avoiding that kind of language and actually just approaching it as conflict in relationships is really normal. When there's conflict in your relationship, what did you do and what did your partner do? And so when we utilise measures like that, it really showed that there is a significant proportion of victims who are male, that women could be perpetrators, but also that there are very similar levels of abuse in same-sex relationships. It's also been used within wider family, so it demonstrated as well the prevalence of other forms of family abuse as well. Now, that research was criticised at the time and has been since for not capturing the context, quote unquote, and the impact of the forms of abuse. So around 15, 16 years ago, there started to be a wave of research that then looked at men's experiences in more detail and more of a targeted approach. And this research that started with Denise Hines' original study in 2007 where she utilised callers to a domestic abuse hotline for men in America, 190 callers. And that was the first time that somebody had sort of published a really in-depth exploration of men's experiences. And it revealed the prevalence of physical abuse that they experienced, as well as other forms of abuse, and the fact that many of them were frightened, many of them were fearful of being injured. Like, the impact that this abuse had was really clear in that study, and it really kind of put it challenged this kind of concept that actually, well, okay, yes, in these conflict tactics scale studies, you've got men saying that they've experienced abuse, but when a woman slaps a man and a man slaps a woman, it's not really the same thing. So it really accounted for that, and it really allowed us to understand for the first time, actually, that the abuse men experienced was serious and was injurious and was something that would cause serious harm. Since that study, there have been a number of others. So the first study there, I can't pronounce that name properly. I always get it wrong, so I'll just avoid it. That's a study from the Netherlands in 2013, which looked at men's experiences and again found that the most common forms of abuse that men had experienced include being pelted, stabbed with an object, kicked, bitten, or seized by the throat and scratching. And in over half of the cases involving physical violence in that study, the offender had used an object, predominantly a household item, such as a chair, a knife, a vase, or a tableware. There was another study as well by Walker et al. I'm pretty confident that was based in Australia, where they again looked qualitatively at men's experiences and asked men to describe and talk about what they had experienced in their relationships. And you can see some examples there of quotes on the slide. Now, with my research, what I wanted to do was something slightly different, because many of the studies that had been done before, where we'd looked at their experiences in depth, had really focused on help-seeking samples, so samples where men had already come forward and asked for help or had called a helpline. It was using data from that. Or it was using interview-based studies where you would have to sit across from somebody, particularly obviously pre-COVID, face-to-face to talk to somebody about it. Or it was using words like domestic abuse and domestic violence in the advert for the study. My experience working with Mankind in the area has really led to the fact that we know men don't always recognise their experiences as domestic violence and abuse, that they experience a number of barriers that I'll talk about today in terms of that help seeking. So I really wanted to try and offer an opportunity for men to share their experiences that didn't require them to talk to me directly, to acknowledge like the domestic abuse label and that language, and to share in depth what had happened to them. So my first study that I did in this area, kind of to collect this type of data, was using an online anonymous qualitative survey. So it meant that men could tell me anonymously, I would never know who had taken part, what had happened to them. And this was for me to try and, excuse me, like I say, facilitate the disclosure, facilitate them telling somebody in their own space, in their own time, and kind of overcome some of those barriers. So there were 161 men that took part in that initial study, and 25% of them had said that they'd never told anybody else before. So I felt quite pleased that we'd captured some more of those experiences, even though obviously there would still be a huge number that I haven't captured there. So as you can see, some of the examples I've included on the slide of the physical abuse that they experienced is there. It included some really serious physical violence. Many of the attacks would have required hospital intervention or certainly medical intervention. It could have been injurious in that way. But I also really noticed across it, and it's kind of similar to that first study that I mentioned, that there were many times men were talking about being attacked with a weapon or an object. And there were also times men talked about being attacked when they were more vulnerable. So, for example, when they were asleep or in the shower. So that was, again, a really important study, I think, for me, particularly, like in terms of kind of getting access to those voices that hadn't always been captured in the research before. So what else do we know about their experiences? Well, we know that men are injured from these experiences, as that kind of data that I just mentioned talks about. But there is a study that was done in the US a couple of years ago that I was part of, where we looked at the hospital records across a 10-year period, and we looked at any of the injuries that were kind of categorised or as labelled as being due to IPV, I've put there, sorry, domestic violence and abuse from a partner. Now, understandably, expectedly, sorry, the vast majority of people presenting were women, but you can see 17.2%, so over 350,000 men also presented with injuries due to domestic violence and abuse. And what we wanted to do was look at what this looked like, what did these injuries look like, and whether there were any differences. And what we saw was that intentional striking, so hitting, was the most commonly reported mechanism for both men and for women. But the second most common cause for men was being cut or pierced, so being stabbed in some way. And that accounted for over a quarter of all men's injuries, but only 3.5% for women. So we then looked at it and we found that men were significantly more likely than women to have been cut or pierced or stabbed, as well as to have been bitten, to have been run over, to have been burned, and to experience any sort of injury via a firearm or a gunshot wound. Women were significantly more likely to have been struck or to have fallen. So this was really important because it really suggested and pointed to this idea that actually when we think about training and we think about how healthcare professionals learn about things like domestic violence and abuse, that men and women are presenting differently when they are presenting to these settings. We saw men were significantly more likely to have been presenting with these types of injuries, and women, it was different, so it looks different. What was also important to note was that women were most commonly presenting, so obviously more women than men were going to A&E, emergency department with this, but men were more likely to have to be admitted. So where women would come, be treated and go home, men were significantly more likely to have to stay in hospital. And we looked at that and kind of pointed to the fact that this is probably likely to be due to the fact that men only seek help when their injuries are the most severe. So if they can get away with not, they might not. But actually when they go in, it's because it's really serious. And so they're having to stay in and have serious intervention. We also know that men experience sexual abuse from their female partners. So Hines and Douglas, or Denise Hines, is one of the original research in the area. She's done a huge amount of work in this area. They found in their study that of the 611 male victims, so they were help-seeking male victims who had experienced domestic violence and abuse, in their study, almost half of them had experienced some form of sexual aggression in their relationship, and over a quarter had reported that this was serious or severe sexual aggression. And then in some work that I've done with Siobhan Weir at Lancaster University, we looked at men's experiences of sexual violence in the context of domestic abuse. And there were, again, a range of different ways in which men talked about being forced to have sex when they didn't want to. And this ranged from a range of different acts or tactics, as we talked about, in terms of how this occurred. So, for example, physical force, threats and coercion, as well as taking advantage, again, of when they were vulnerable. So as you can see from the second quote there, when somebody was on medication or when there's been alcohol. And the last quote there also points to the fact that there were a number of men that talked about sexual coercion and sexual aggression through things like manipulation of pregnancy as well. We also know from the literature that men experience many forms of non-physical forms of abuse as well, so psychological abuse as well as coercive control and things as well. And again, I've just included some quotes from some of the research that we have at the moment on this. We see men talk about psychological and emotional abuse. We kind of use these terms interchangeably. There's a lot of overlapping behaviours that categorising kind of these two terminologies. But really, this is the examples of when men are belittled, when they're constantly put down, when they're being humiliated, when there is this range of different ways, these psychological strategies to make that man feels small, to put him down and to make him feel inferior, like he's not man enough, all of these kind of things. And so there's a range of different forms of this type of abuse that we see within the literature as well. Now, in terms of coercive control, the research also details a range again of different ways in which men can experience this. So here are some quotes from my original study that I mentioned before, and these include things like isolation, threats and manipulation. So as you can see from some of the quotes here, it included things like threats to leave, it included threats towards and about the children or about the relationship with the children. It included things like isolating them from their friends and family. As well as kind of as that kind of isolation happened, it would those relationships would become affected because I say she, and I should have said sorry, that most of my work is focused on working with male victims of female perpetrated, which is why I'm using these pronouns. But where she would be basically slowly isolating him and then impacting the relationships around him as well to really destroy that social support and that social network. And one of the questions that I get asked quite a lot is why people, men, don't just leave relationships. And it's the coercive control is really a massive part of this, because as that second from bottom quote kind of alludes to, my wife insisted I stop socialising. I was with her now, and if I loved her, I would not want to spend time with anybody else. And it isn't the case that when you are on like date number one, it's all lovely and happy and, you know, nice. And then date number two, it's like, right, you can't see your friends and family anymore. That's not how these strategies work. It's like a drip, 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 insidious approach to control. That means it's only often when men and women, I'm sure to be fair as well, look back on the relationship, do they realise actually how bad some of this sort of abuse was. But it kind of slowly develops until they become trapped. Another form of psychological abuse and emotional abuse is gaslighting. And I think it's something that's been talked about a lot more now, but it was certainly at the time was not language that some people understood. So I included like a definition of what it was and what sort of abuse that occurred. And there were many men that acknowledged that this was the sort of abuse that they'd experienced. So they felt like they were doubting their sense of self, who they were, what was happening, their perception of reality. It really undermined the trust that they had in their own knowledge and their own knowledge of what had happened to them. And that first quote on the left there really points to the fact that this is an effective strategy in the midst of that wider pattern of control and abuse. So where somebody has become isolated from friends and family and from a social network, then when you've got one person that is putting you down and belittling you and making you doubt yourself, there's no other voices to challenge that. So it's a strategy that unfortunately is extremely effective in terms of the impact that it has. And to mention another form of abuse and aggression that is something we see that men tend to experience more, it's something called legal and administrative aggression. So this is something that was coined back in 2010 in Australia by Tilbrook and colleagues. And this is basically where one partner manipulates legal and other administrative systems in a way that is harmful. So using those systems as a mechanism of exerting control. So it could include things like false allegations or like breaching child contact orders, things like this. And this is something that men definitely fall more frequently victim to than women, because the sector itself is still set up to see men as perpetrators and women as victims. So there are huge numbers still of gendered perceptions and stereotypes within society as well as within service providers about the nature of what domestic violence looks like. And in that original Denise Hines study that I mentioned, half of the participants in that study have said that their partners were using these systems in some way. And we see that when people are in a relationship, it's an effective threat as a way of controlling somebody. If you don't do what I say, I'm going to say you hit me, I'm going to say this, I'm going to take the kids away. But also post-separation particularly, you see that it is an effective mechanism of abuse as well, where women have used these systems as a way of exerting that control. So I just want to touch on something called identity abuse. And this is a sort of specific type of abuse that is used where it is utilising some of the systemic oppression that we still see within society. So there is still examples of ableism, sexism, racism within society, and it is a way in which this is leveraged as a way to control or cause psychological harm. So people talk about this idea of identity abuse, of a form of coercive control or weaponized oppression. And it's sometimes referred to as cultural abuse, but it is basically using a particular aspect of somebody's identity, a personal sort of characteristic in that way, as a way to demean and manipulate and control them. And it overlaps obviously with a lot of the other types of abuse that I've mentioned. It's first really been talked about within the LGBTQ plus population. So gender and sexual minority individuals have experienced quite unique forms of coercive control, in addition to many of the things that I've just mentioned, but that is unique to the fact that they are in same-sex relationships or that they are, for example, transgender. So outing, for example, is a really common form of abuse in same-sex relationships, where the perpetrator will basically threaten to out their partner to their friends and family or workplace where they're not already publicly kind of out in that way. And similarly, within the transgender community, you will see some people using abusive tactics that could be inappropriate pronouns, dead naming somebody, telling the victim they're not a real man or woman, ridiculing their gender identity, hiding tools that allow them to communicate their gender. So things like chest binders, makeup, or potentially hiding their medication and hormone medication and things. So this is kind of one of the areas it's been looked at in more detail, which is where it is about leveraging sort of the heterosexism and cissexism that exists within the society still against LGBTQ plus survivors. So it's like using a specific part of their identity as a mechanism of controlling and abusing them. I just need to skip forward because my slides are out of order. I've just realised, sorry. So thinking specifically about men's experiences, these are just some examples within the data. So culture is an example where people have men describe barriers to help seeking or experiences of abuse that are related to, for example, their culture or their ethnicity. So within a study that looked at Black men's experiences, there was the fear of bringing shame or disapproval to their community, or the fear of it harming their immigration process or status as barriers that they had experienced specifically. Similarly, within people who are disabled and men who are disabled. So within my data, again, there was an example of a man who was denigrated for being disabled. And it was, again, a way of utilising that aspect of his identity, of his intersectional identity, to exert that coercive control to kind of abuse in a manipulative, in an emotional or psychological way. And for older men, so this is this quote here is the one that really got me thinking about this as an area, which was within some of the data that I have. We looked at older men, so men who were over 60, and one of the things that one of the men reported was that she tried to convince him he had Alzheimer's to basically sign over power of attorney. Now, that is something that is not going to work with a younger man, because despite obviously there being, a recognition of early onset dementia and all these sorts of things, that is not something that would work in a man in his 30s. That's a specific targeted choice to manipulate through the fact that that man is older. And that was really what got me kind of thinking about all the different ways in which people generally, but obviously my work with men, people will utilize specific aspects of their identity. And for men who are fathers, and I haven't talked a huge amount about children today, but for men that are fathers, being a father is such a key part of their identity. And with the men who I've worked with and looked at and talked to about obviously their abuse and things, whenever they are fathers, the most painful part of the abuse is wherever the children are involved, whether it is that they're impacted by it, or that there's the threat that they won't be able to see them anymore, or whether they have split up and they aren't able to see them anymore. That is the most painful part. So just go back a slide, sorry, to this image, which is one I use a lot when I talk about men's experiences. So the study that I'm referring to here, I did with my colleague Julie Taylor, and we looked at using photo elicitation, which is basically an interview method where you use photos instead of like structured interview questions, and you ask whoever you're talking to bring photos that represent whatever it is that you're interested in. So we asked men to bring photos of what it was like having lived with and experienced domestic abuse and an abusive relationship. And this photo's really stuck with me because it was a statue, that has been created to represent grief. I think it's called Melancholia or something. Somebody at the last conference I was at came up to speak to me about it afterwards. And it represents grief. But the man, as you can see from that first quote there, he basically said he'd never seen anything that had represented so much how he felt having not seen his children for several years, like he just felt that emptiness and that grief. So what do we know about the impact of abuse for men? Well, we know that it has significant impacts, obviously in terms of injury, as I've already mentioned, but also physical abuse victimisation is associated with a range of different health conditions and health impacts, including things like substance use, developing chronic disease, chronic pain, gastrointestinal issues as well. There's research, and a meta-analysis, which is basically like a study that has looked at lots of the data from lots of different studies all together. So this meta-analysis looked at and found emotional abuse impacts included things like physical pain and trauma, poor physical health and somatic symptoms, pain, fatigue, etc. And that was associated with the emotional aspects of the abuse. And when we look at obviously different types of abuse together, we see that men's depression, their PTSD, their physical health, and their poorer physical health symptoms are really present after controlling for a range of other things. So basically, when men experience a combination of different types of abuse, these are symptoms that are worse for them compared to men who experience either one type, or obviously men that don't experience it at all. When you control for a range of other factors, it is worse. So basically, the combination of all of these different forms of abuse together has really significant impacts. So for the men in the study that I did, they talked about these impacts obviously in a really significant and in-depth way. There were a range of mental health issues and sort of symptomology, as well as physical health, as well as injuries. And there was a lot of, unfortunately, men talking about either suicidal ideation and suicidal thoughts, or for some suicidal behaviour and suicidal attempts. And many of them talked about PTSD symptoms. They talked about the lack of support networks, so the isolation as well. So the impact of the experiences is just huge in terms of the ways in which it can kind of impact. Now, recently, Lee Curran, who's at Liverpool John Moores University, has published a scoping review that has looked at the links between between domestic violence and abuse and suicide for male victims. I would really recommend reading that paper. I'm happy to share the link with anybody that would like it. It basically collates and found that there's a consistent evidence that male victimisation is linked to an increase in suicidal behaviour. We know from the wider literature as well that relationship conflict and the abuse they experience, these are major contributors to this suicide risk across the body of work that he and his colleagues had reviewed. And some of the pathways that link victimisation to suicidality includes the mental health impacts, which I've just mentioned, but also things like the shame and stigma around men's experiences and around that victimhood, the barriers that exist to their help seeking, the social isolation and lack of support that they have, both because of the abuse, but also sometimes obviously because of a lack of recognition of that abuse within wider society, as well as then also layers of kind of complexity around masculinity and the masculinity norms and the male gender role and what that means around help seeking and stuff as well. Now, his review basically highlighted a range of gaps about stuff we still don't know, but it was a really important kind of first step in highlighting these links that hadn't really been kind of shown before. So what do we know about the barriers to help seeking? Well, we know that men experience a range of different barriers to help seeking, not just for domestic abuse, but more broadly. So we know that men are less likely to seek help across a range of domains, including things like going to the doctors and other healthcare things as well. So there are some layers of these barriers that are around masculinity and being a man and what it means to ask for help, and like I said, the male gender role, the fact that men are supposed to be stoic and strong and emotionally strong and all that sort of thing. So those are kind of layers of it as well. But as well, there is the layers where there's still a lack of recognition broadly about the impact of abuse on men, about how many men can experience it. So there's a worry about not being believed. There's also sometimes a lack of support and services available, or certainly in areas a lack of the perception of it. So it's perhaps available, but not looking like it's available, not kind of visible is perhaps the right word. But there are also different layers, again, of fear. So fear of being judged by others. There are group-specific fears. So like I mentioned before, for example, the fear of being outed, or it could be a fear of deportation if there's an insecure immigration status. There's the fear of not being believed. So there's the fear of asking for help and somebody saying, well, you're a man, that can't have happened, you must have started it must be your fault, all these kind of sorts of things. And unfortunately, these are experiences that we see in the literature of what men have experienced, poor service responses, including being laughed at and humiliated, being ignored, as well as sometimes being referred to batterer programs. So there was a man that I remember saying in one of my studies where he'd called a helpline, and they'd given him a number to ring, and when he'd called it, it was for perpetrators. So there's also these experiences of victim blaming, and we see this within the literature that looks at attitudes as well. So when you basically talk to people about what they think about domestic abuse using scenarios and little stories about stuff, and then you ask them questions, you see a consistent pattern where we don't see men's victimisation, as being as severe as women's victimisation, as in need of support, as in need of police intervention or healthcare intervention. We blame men more for their victimisation. We assume men must have done something to deserve it, like a range of different things that we see. And the barriers exist more when there's no physical impact. So when men either they're not injured by it or that they are experiencing those non-physical forms, when there's nothing to point to and show, they fear all of these things a lot more as well. And I think that, and I kind of talk about this a little bit sometimes at conference, when we talk about the perceptions of coercive control and the perceptions of those non-physical forms of abuse, we see them very differently for men and women. And I always use the example of, if I said to my group of girlfriends that my partner Michael wasn't going to let me come out tonight, I'm not allowed to come out, they would be all like, red flags, this isn't okay, what the heck is happening? If he said to his friends at work, who are mostly men, that I wouldn't let him go out, it would be more like, oh, you under the thumb, you must be a bit henpecked, oh, that sort of. So the perception of how we react to men and women in this way is very different, and that plays into these barriers. And one of the studies I did again with Julie Taylor from the university, as we looked at these barriers to help seeking, we used that same online anonymous survey to try and actually collect the information and the data from men who hadn't asked for help, as well as those, that had and talked about those barriers as well. And what it all comes back to, as you can see from this diagram, is the barriers and the different sort of aspects of it, the responses and those different aspects. It all came back to this idea of a stigmatized gender. So it all came back to the fact that they were men in this sector, in this society that doesn't see men as being victims of abuse in this way. And I just included a couple of slides with some quotes from this study as well. So many of the men talked about thinking that they were on their own, that they were the only one. They talked about shame and embarrassment. The other factors came into it, like their age, for example. And again, here, as you can see, that first one again, that kind of women ringing a helpline and having the response completely change when they realise that it's a man or that they're talking about being victimised by a woman. And so the responses that people have, the responses that men have, when they either report it or they try and ask for help, is so important in terms of what happens next. Because basically what tends to happen where there are these responses is men won't ever tell anybody else again. And that last quote, I think, is really powerful, where we do, and I've said today, men are less likely to ask for help. Men don't ask for help. But actually that quote says, but in my experience, men try or do ask for help and are told to shut up. So they try, and that it's either not there or the response is poor. So just to kind of end with a brief kind of comment about a study that I've done with some service providers. So the research that there is already around service providers has kind of looked at particularly how to support men within this area, the barriers that they experience. So that Wallace study that I've mentioned there at the top, she interviewed 20 service providers and talked about this cycle where there isn't the help and support there, but then men don't recognise their experience and they don't know where to go for help. So they present to services in low numbers, which then means that there isn't that evidence of the need for it, which then means there isn't help and support. So it kind of gets into this cycle. So those low reporting numbers means then that we struggle to evidence sometimes the need for that provision. And we know as well that for some service providers will experiences of supporting male victims. We sort of see that they suggested the service provision is a bit of a system set up so that women have set the service sector up, and so it's for women, it's kind of framed in that way. And Ben Hine and I did some work looking at experiences of call handlers on a helpline for male victims, and identified a range of different barriers that they talked about, including a lack of funding, postcode lotteries and that sort of thing. But what I did in the study that I've just done is I used something called a deliberative inquiry, and I won't kind of go into it too much, but if you're a research methods nerd and you want to learn more about it, I'm happy to share because it's a really cool method to use. I also get told by my partner a lot that I use the word cool incorrectly, so I'm sorry, that is not cool, it's nerdy is what it is. But basically I got a group of practitioners, survivors and academics and researchers together, and I asked them basically about how can we work together to make a more inclusive domestic abuse sector. We talked about the barriers that there were, then we talked about solutions, and we agreed some priorities. But just to mention a couple of things that came up, Some of the challenges that they talked about, understandably and not surprisingly, was around funding, that there's a lack of funding, but that the participant, as you can see on the first quote there, basically pointed to the fact that the vast majority of funding goes to the same few people or the same few organisations in the area. The gendered nature of the sector. So again, I'm sure that everybody's aware of it here, but obviously the violence against women and girls strategy is a massive barrier for practitioners, as well as obviously for men recognising their experiences. And one of the academics that took part as well talked about there being an unwillingness to work together within the sector. So in an attempting to try and bring different groups and stuff together, like even in this kind of conversation, there's a real unwillingness to work with people. But for me, one of the most alarming things that they talked about is almost like a toxicity that exists within the sector. So these quotes kind of point to it here, but that there is, when you're trying to work and be more inclusive in your approach, when you're trying to support men as well as people in the LGBTQ plus community, as well as all these sort of other intersectional identities that there are, it's like there is still a resistance within the sector by some professionals, by some organisations, that it makes it really toxic to try and actually make change in the area. So whether it is that it is a group of, it's like an in-group that you can't get into and nobody wants to kind of let anybody different in, or whether it's like almost having to kind of play a game to try and get your foot in the door to even then start to talk about men. There was this real kind of powerful thing that came out across the discussions around that, which I found really interesting, obviously on a kind of academic level, but really alarming when we think about trying to work in a more inclusive way in this sector. So I suppose I conclude in thinking about, obviously there are loads of implications for policy and practice around what I've talked about today, but I think that there's a real recognition, an increase in recognition, I should say, of men as victims, which is really positive, obviously. There's a recognition more of the impacts of it, but I think that the lack of awareness of the proportion of victims that are men, the impacts in terms of like the wider health impacts that it has, and also the way in which we still respond to women who are violent, which, as you can see just from some of these headlines here, really we show that actually when a man is violent to a woman and a woman is violent to a man, we respond very differently, despite the fact that what they are presenting with is a very similar experience and a very similar risk. If you're presenting with the same experience and the same risk, you should be responded to the same, regardless of what your gender is. So for me, there's still quite a lot of work to do in this area in terms of talking about these things and trying to kind of increase that recognition within a wider policy and practice area. So I've actually done okay for time. I'm quite impressed with myself. It's not too bad. But if anybody would like to ask any questions now, I'm really happy to take any questions. My email address is on the slide. I've put my Twitter on, but I don't really go on Twitter anymore because it's a bit grim, isn't it? But I'm also on LinkedIn. Happy to share any of the papers that I've talked about today. Happy to share any of the my slides and stuff as well. And just a thank you to some of my research assistants that have helped me with the projects that I've talked about today.